We have two beautiful daughters. The youngest, Natty, has Down syndrome. But although she's now 7, it's only just recently that I've learned about learning disability nurses, surprisingly. It was only when I attended a British Institute of Learning Disability conference as a mum and a speaker that I did actually first hear about learning disability nurses. I met the inspirational Jim Blair. I sat in the audience and listened, and I learnt for the very first time about reasonable adjustments. I learnt about death by indifference, about Winterbourne. I learnt in detail about disability hate crime, and I sat with fat tears plopping from my cheeks onto my smart dress-to-speak skirt. And I have to say I cried with fear for my 5-year-old, at the time, daughter's future. I also cried with gratitude for those individuals, charities and organisations who care as deeply about her and her rights and the rights of others with learning disabilities as I do as a parent. For where on earth would we all be without you? Until that point in time, we as a family had been supported by an incredible mix of neonatal nurses, consultants, health visitors, portage workers, all mixed in with a few professionals who were more ambivalent and sometimes even those that were hurtful. But we picked our way through and instinctively drew close to those who understood, who got it, if you like. There were a long list of medical angels, the GP whose grandson also had Down syndrome, the breastfeeding counsellor who got us through expressing and nasogastric tube feeding until Natty finally got it, the wise midwife who just told me to go and love Natty, whether we lost her or not, because she needed that love. So many wonderful medical angels, but not once had we ever heard about learning disability nurses before. And once I heard about them at the Build conference, I still assumed that you just existed for adults with a learning disability. When Natty underwent keyhole heart surgery at Bristol Children's Hospital when she was just 2, her needs and ours were catered for so completely by all the staff there. She was so very tiny and didn't really understand what was going on. We were there to support her, and we in turn were completely supported by everybody, from phlebotomists to play therapists to the general nursing staff on side. So at that point, again, learning disability nurses didn't come on our radar. Back in the summer of this year, at 6 years old, the time came for Natty to have those pesky tonsils and adenoids out that were causing obstructive sleep and making her so very tired, depleting precious oxygen and stunting her growth. So off we went, and still assuming learning disability nurses existed to support and mediate for adults, I really thought nothing more about asking to meet one or the team and about their services, which weren't routinely offered. Then a chance meeting. Natty, ever the icebreaker, was jumping up and down excitedly in the hospital corridor as we left the pre-op play therapy run-through because she'd spotted her portrait hanging on the wall in the corridor as part of a Trisomy 21 photo exhibition that was started locally. A passing lady with a badge smiled and we got chatting, as is my wont, and it turned out this lady was the head of the learning disability nursing department. She immediately offered to support Natty through her op and called me at home later the same day. We mainly chatted through my fears of Natty's needle phobia, my fear that a pre-med would result in panic, which would be learned for the rest of her life, and subsequent hospital visits and operations would become more and more traumatic for all of us as a family. We chatted through the use of a mask, and she said she would put that straight through to the anaesthetist. And it was all arranged swiftly without any more worry on my behalf. Then the date of the date of the operation was cancelled, but we were so ready. We'd been practicing with Natty, we'd been looking at books, we'd been packing her little bag and getting things ready. We felt emotionally ready, in a way that it's almost impossible to describe, but to wait for a new date 3 months away was almost too much to bear. And again, the learning disability nurse stepped up to the fore, and she explained the situation. She explained that putting the date off for Natalia would be quite difficult, and a sooner date was found for us. It happened again one more time, to be honest. There was a hospital reshuffle and more operations were cancelled. But to cut a very long story short, we were put to the front of the queue, and even on the day of the operation itself, Natty was put first thing in the morning so that she wouldn't have to go all day hungry and not understanding why she wasn't allowed to eat. These were all seemingly little touches, but they made such a difference to the way that the hospital procedure went for us and for Natty. And I do remember actually even breaking down in tears over the phone with the learning disability nurse and explaining that I was just so nervous about this operation that it was throwing up all kinds of emotions and memories of the heart surgery. And she understood me. She listened. She didn't make me feel silly or neurotic. And she was able to smooth things over. And in an instant, I realised that what you do is not just for those with learning disabilities, but very, very much for their families too and their carers. This lady gave me permission to worry. She validated my feelings. We chatted through my fears. She understood the history, and she also understood my fears for the future, that it wasn't just a one-off operation, that we did have to plan, put things in place for the rest of Natty's life and make sure that things went smoothly. We got chatting on the day. Actually, while Natty was in theatre, she came to see me, and she was an amazing woman. We chatted at length about the role of learning disability nurses, and I think I saw in an instant that what you do is mediate, you translate between families, patients, and doctors who can sometimes be rather focused on the job at hand and not really looking at the person behind the symptoms or the patient. So you are communicators. You are the cement between the two, and your role is invaluable. It removes fear. It makes things go smoothly, and even the bottom line is that you save money for hospitals because things go right, they don't go wrong. There aren't mistakes made. Worse, we all know the death by indifference, the bottom line. We need more learning disability nurses, and you need to know how very much you're appreciated. Thank you very much.